Hello, everyone, and welcome to the 2020 Texas Tribune Festival. My name is Edgar Walters. I'm a reporter here with the Texas Tribune, and I'm joined today for a 30-minute conversation by Dr. Peter Hotez. Dr. Hotez is an expert in vaccine research and development, and he is the founding dean, I believe, of the National School of Tropical Medicine at the Baylor College of Medicine in Houston. Dr. Hotez, thanks for joining us.
Edgar, it's great to see you again, even if it's virtually this time.
Likewise. Dr. Hotez, I figured we would just jump right in and address some of the president's recent comments, which come in contradiction to those of some of his scientific advisors. The president has said that there will be a vaccine available for the coronavirus before the November election. What do you make of those comments? Are they dangerous? And can you tell us what you see as a realistic time frame for having a vaccine available?
Well, the comments by the president are more or less in line with what he's been doing all throughout 2020, which is he's made statements that contradict what the scientific community has been stating, what the published literature has been stating. He's kind of trying to mold our epidemic in the U.S. to his own agenda, presumably for what he feels will help him to get reelected. So this is just more of the same. The actual time frame for the vaccine is becoming more clear as we collect more information. At least with Operation Warp Speed, the U.S. vaccine program, we have 3 vaccines that are now in phase 3 trials. The 2 of the mRNA vaccines from Moderna and Pfizer, although Pfizer is officially not part of Operation Warp Speed. Most people treat it that way. And then the AstraZeneca Oxford vaccine, which is on pause right now, but that will probably come off pause soon. And by the end of the year, we'll have enough data to know whether at least one of those 3 vaccines actually works or not and is shown to be safe. And then we can slowly begin rolling it out. So I've been saying all along, Q3 2021, and I've been saying that since early spring, and that's more or less what it's going to look like. In addition, there are additional Operation Warp Speed vaccines coming through that will add to this, and then we also have a couple of vaccines internationally, including ours, low-cost recombinant protein COVID-19 vaccine that we're accelerating for production in India. So it's going to be quite a robust pipeline. And a lot of complications with that, too, because there's going to be different vaccines that have different performance. Some will actually prevent infection. Others may only reduce severity of illness, which is still important. And so there's going to have to be a lot of communications about which vaccines are the best ones and when to get boosted and all that. So we're going to need an unprecedented level of communications, which we don't have right now, unfortunately.
Right. You mentioned the AstraZeneca trial, which is currently on pause. Some of those disclosures about the adverse event in a trial participant that led to the trial being paused, I was struck by the fact that some of those came to light, for example, in an investor call that was leaked to news media and which was eventually made public that way, sort of through the news media. Is the U.S. government doing enough to ensure transparency in the vaccine clinical trial process, or what information do you want to see out of the U.S. government as it relates to these trials?
So I actually have a very high level of confidence in the science and the Operation Warp Speed program, how the vaccine clinical trials are being conducted. I think they're being conducted with a high level of scrutiny and integrity and scientific rigor. That I don't have a problem with. I've even been involved in some of those discussions, and my role is on the NIH active vaccine working group. I have no problem with that. The problem is the communications have been abysmal. Operation Warp Speed has never put in place a communications plan or a strategy, despite my pleas directly to the White House and to the NIH. But they've made this executive decision to leave it to the companies. and I knew it was going to be a disaster, and it is a communications disaster. I mean, the last way you want the American people to find out that there were two pauses in an AstraZeneca trial is secretly or not so secretly recorded conversation from the CEO to his investors. That never should have happened. It undermines confidence, and that's not the only gaffe. We've had, Moderna has had a lot of issues in terms of how they're sending out press releases and all of the alleged conflicts of interest and the stock trading. It's creating a lot of problems. So Operation Warp Speed really needs to get ahead of this and be out in front on the communication side, because we're already seeing now polls coming from the American people, from Reuters, from Associated Press, elsewhere, saying up to half of Americans will refuse COVID-19 vaccines even if they're made available. And it's all because of these communication errors. One of the other things that I often tell people is, AstraZeneca and Moderna are not vaccine companies. They're new to this. And you might say, well, why does that matter, Peter? And the point is, if it were Merck or Sanofi or GSK, one of the traditional vaccine companies, they know how quickly a vaccine can derail and get voted off the island, even if it's a good vaccine, because of public misperception. We have lots of vaccines out there that are good vaccines that were never used because of misperception. And there's a danger that this could happen here. So we've got to fix that and fix it quickly. So bottom line, I think the science is being done well. I have a lot of respect for the integrity of the trials. I feel confident that if and when some of these vaccines are approved, I would take these vaccines, I would give them to my family. But if they don't fix the communication problem, fix it now, there's going to be a lot of issues down the line.
What I'm hearing is it sounds like there's kind of a disconnect in the quality of the science, which you're saying is high, and the public's sort of perception of the science or the credibility given to it. And I wonder, there have been many recent examples coming out of CDC news reports suggesting that public affairs officials in the Trump administration tried to change the text of CDC's weekly reports on mortality and morbidity, or examples of other kind of political influence, frankly, at the CDC. And I wonder if you see that as a scientist, does it hurt the level of trust that you have in our leading scientific government experts?
Yeah, and continuing along our theme of terrible science communications, the only ones worse at communicating science than these pharma CEOs have been the White House Coronavirus Task Force. They've been awful communicators. If you've ever listened to one of those task force briefings, they're practically unintelligible. You don't learn anything about them. They just have never structured them in a way that I would ask any first-year graduate student to do it, which is, present your problem list. What are the big problems that you're working on? What are your concerns? What could go wrong? And how are you going to address it? It's as simple as that. And they would never take that strategy. You'd have the vice president, talking about prayers with Karen and his wife and all of that. Then you've got this incomprehensible series of facts and factoids that you never could really connect them in any meaningful way. So that was terrible. So that's problem one. Problem two is the fact that you had a lot of meddling with the agencies, and especially CDC and to some extent FDA. And in that sense, that's not so new. I mean, I was previously in Washington, D.C. as chair of microbiology at George Washington University, and I saw up close, how the White House does try to interfere with the activities of the agencies, especially in health and human services. The difference is, in the past, the agencies have always managed to have a firewall to prevent that undue influence. And the NIH has still pretty much had that and blocked it, but things really broke down at CDC for reasons I don't understand. So that's really created a lot of issues. And then the third is the outright anti-science disinformation coming from the White House, coming from this new White House science advisor that the president has put out there. I mean, outright misinformation, disinformation about questioning masks or espousing discredited concepts around herd immunity and safety of schools, and that's really done a lot of damage as well. And this goes back to the vaccine program. If the American people don't trust what the White House is saying, and we can't trust the pharma CEOs, who can we get up there to actually have a meaningful discussion about the vaccine program? And we're going to have to identify some good people who can do that. I could think of some names who would be really good at this, but the White House has to want to make that happen.
What about for you as a scientist? Do you find yourself now taking CDC reports with a grain of salt? Does it affect the extent to which these reports have credibility to you?
Well, I take nothing at face value, and this is why I like to see things in the published literature. And if it can't be in a full paper, at least put it up in one of the very good preprint servers like bioRxiv or medRxiv. So at least I can review the data and see what the statements are being based on, because that's really the only way to know. And then I try to do my small part by going on the cable news networks or in podcasts like this, and to be able to translate the science and language that people can understand, and doing it in a way not like the White House Coronavirus Task Force does, which is talk to the American people like they're in fourth grade, but talk to the American people like they're adults and really try to explain the science and the nuance, because I think the American people have gotten very sophisticated over this year. They've read a lot about COVID-19, and we have to stop treating them like they're in fourth grade.
Yet, as you brought up, there is, of course, the sort of lingering policy problem of, at least currently, polling indicating that there's low level of trust in the vaccine process, or at least people saying that that they are hesitant to take a vaccine if it becomes available. Can you make the case that so you said basically a year from now, quarter 3 of 2021 is when we might expect a vaccine to become available to the public. But you said by the end of this year, widely available. But by the end of this year, you said the research would essentially indicate whether or not there were a safe vaccine. Can you make the case that by end of the year that's enough time?
Yeah, I think so. Given the pace of the phase 3 data and the fact that because the White House never launched a COVID-19 containment strategy, we're going to have an enormous amount of transmission this fall, tragically. So I think we can get to that answer just because there's so much COVID-19 transmission, to be able to compare the individuals who are vaccinated versus the individuals that won't. Look, there's still a possibility with those 3 vaccines, none of them will work. That I don't think that's going to happen, but that's a possibility. And there are other vaccines coming along. So eventually, I feel pretty confident we'll have at least one, probably a few vaccines that work and are effective. And the reason I say that, it's not that complicated a virus. I love the term that Carl Zimmer, the science writer from the New York Times, throws out. He calls the COVID-19 virus clumsy prey. And he's right in the sense that it's an old school problem in virology. If we can get a vaccine that induces high levels of virus neutralizing antibody and some T cell responses, we'll have a good vaccine. And that's why we're scaling up ours in India right now, a low cost COVID-19 vaccine. Myself, together with Marilena Batazzi, my science partner for 20 years, we're leading the acceleration of that. We transferred the technology to Biological E, one of the big Indian producers, and we feel pretty good about that one. The point is, I think there are lots of ways to do this. It's just a matter of giving it the time to show that the vaccines are both safe and effective. And that's the hard part of vaccines. It's not, there are some scientific hurdles, but the hard part is showing that you've got a vaccine that actually works and is safe.
Right. Is there any risk that somebody in a clinical trial today gets a dose of a vaccine and there is an adverse event or effect, but it doesn't happen until several months down the road? Is there any chance of that happening?
Yeah, it happens all the time. And that's why even after the vaccines are licensed, we have an incredibly robust regulatory science system in the United States. We have at least 4 parallel systems in place to monitor vaccine safety, which include the Vaccine Adverse Events Reporting System. They all go by complicated acronyms. There's the Vaccine Safety Data Link and at least 2 others. So we have in the United States one of the most robust, proven programs of pharmacovigilance and monitoring for safety the world has ever seen. And that will be watched very closely. So again, I feel that if we go through the licensure process, which is extremely robust, and the post-licensure process, the American people can feel assured that they're being protected. And that's why I worry when the president makes statements that he's going to try to accelerate this and rush this in a way that might compromise that process. It's taken us decades to get to this point, and to undermine it just for political expediency would be really tragic. I don't think it'll happen. I think the scientific community and the FDA has the ability to hold the line. I just hope the president doesn't try to push that agenda.
In Texas, we have a very vocal anti-vaccine and anti-science contingent. You have been a target of them in the past, and you pay fairly close attention to their activities. To what extent do you see misinformation campaigns or other sort of campaigns from the anti-vax movement playing out when it comes to the coronavirus vaccine?
Yeah, this has become a really dangerous enterprise now. So the anti-vaccine movement, or the modern day one's been around for 20 years, but then in 2015, with the start of the campaign, the anti-vaccine movement made this kind of sharp pivot to the far political right and to political extremism, and that's when and this kind of libertarian streak that they call health freedom, and that's when Texans for Vaccine Choice was formed in 2015, and that's when you got people like Alex Jones campaigning against vaccines, and that was really worrisome. So you had Texans for Vaccine Choice, Oklahomans for Vaccine Choice, this far political right health freedom movement. And now what it's done is it's glommed on not only campaigns against vaccines, but campaigns against masks and contact tracing, social distancing, again, promoting these fake concepts of herd immunity. So all the crazy stuff you're hearing from people like Scott Atlas or Senator Rand Paul, a lot of that came out of this health freedom nonsense that's been going on in Texas now. And now it's a full-on anti-science movement, and it has deadly consequences. If you look at that whole second peak of COVID-19 across the southern United States, that's at least 60,000 lives lost. And a lot of that I attribute to this anti-science movement. And if that doesn't keep you up at night, now we've got these new revelations that that American-style anti-vaccine movement is now expanding into Europe. So last month, there was a rally held in Berlin, Germany, with 38,000 people that the newspapers are saying it was supported by far right-wing groups, including neo-Nazi groups in the neo-Nazi party, and some of the leaders of the anti-vaccine movement from the U.S. spoke there. So this is going out to a full-on anti-science disinformation campaign that's global, and it's going to have terrible consequences. And it's a reason I wrote my new book, which will come out in January. It's called Preventing the Next Pandemic, Vaccine Diplomacy in an Age of Anti-Science. And anti-science has really become a dominant theme, and it's extremely dangerous. And we're seeing it play out now with the White House briefings and the misinformation coming from people like Scott Atlas. You heard the exchange between Senator Rand Paul and Tony Fauci yesterday. The other scary part is anti-science has become mainstream. It's become fully integrated now into the president's reelection campaign. So as much as I don't like to wade into politics, it's not an area that I'm experienced with or have a deep knowledge about, you have to call it out. I mean, just not to say anything and just pretend I'm only going to focus on the science and not call out individuals or groups that are actively promoting anti-science. I've decided that just maintaining that neutral stance is in itself immoral. You have to call it out. And one of the reasons I'm doing that is I'm starting to see how it's particularly affecting people living in low-income neighborhoods. This virus is causing what I'm calling historic decimation of Hispanic communities across Texas and the southern United States. People who can't make a living via Skype and Zoom calls, and they're essential workers, bus drivers, people who work in family-owned businesses, restaurants and dry cleaners and bakeries, or working on construction sites. They're just getting devastated. And how do I know that? Well, I can see it every day. In the Houston Health Department puts out their daily death list, and it goes. It doesn't provide the name, but it gives you sex, age, and race or ethnicity. It's every damn day. It's Hispanic, 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 Black, Black, Hispanic, Hispanic. This is happening across all of the metro areas of the southern U.S. And I feel it's really important to speak out and call it out and say, this is the consequence of an anti-science disinformation campaign.
Right. But it's not only federal policies that have contributed to the way the pandemic has played out. Obviously, you mentioned the southern sort of summer surge that was experienced in Texas, particularly in South Texas. There were just really horrific scenes coming out of overwhelmed hospitals in the Rio Grande Valley, in the sort of coastal Bend region, also very Hispanic, demographically Hispanic parts of Texas. A lot of that has been linked to the decision in May to begin reopening in Texas. And I wanted your take on that. Essentially, did Texas reopen too quickly?
Yeah, well, I think Texas reopened too quickly, and not only reopened too quickly, but did not have all the belts and suspenders of a public health infrastructure to manage the reopening, even if we had waited. So I think that was a problem. But you know what? I make the point that this is not unique to Texas. This was true in Georgia and Florida and Louisiana. It's true in Arizona and even in parts of Southern California. And so, I get a lot of questions, especially here in Texas, because, people are trying to get me to blame the governor, lieutenant governor, the legislature. And I say, no, I still point my fingers at the White House on this and say, look, if we had that leadership that had put in place a national campaign and strategy to prevent the resurgence of COVID-19, we never would have been there. If they had put the CDC out in front, let operations run from Atlanta, stick to the science, and have that federally led directives for the states so they knew how to do this. The states never had the horsepower to and the epidemiologic models to know how to do this. And what's more, the governors for all these states needed the political cover. I mean, they basically needed to say to their constituents who are, putting a lot of pressure on them to open up, for the governors to say, look, I understand what you're saying, but the CDC is telling me if we don't do X, Y, and Z, this many Floridians will die, or Louisianans will die, or Texans will die, Arizonans will die. And I'm pretty confident that conversation never happened. So again, this is the fault of fault coming out of Washington, that we never led that national COVID-19 response. And we still don't have it. And you know what? We're about to suffer a third peak. The numbers are starting to go up. And again, you've got people like Scott Atlas and the president saying we're still going to open up schools despite the high level of transmission. You've seen what's gone terribly wrong with opening up the colleges. And again, we don't have the advocacy. Here in Houston, taking a walk in the neighborhood with my wife, I don't see people with face masks on. It's business as usual, and we could have a resurgence. A third peak that's potentially even worse than the one we just went through this summer.
So what recommendations would you give right now? Close schools to in-person instruction, no football games. Where do you come down on some of these, big gatherings, potentially spreading events?
Yeah, so I put forward a plan I called my October 1 plan. I put it out in July, said if we do X, Y, and Z, bring the whole nation down to containment mode. In some states, we don't have to do anything differently. In others, more aggressive measures. If you do that, we can open up schools safely, colleges safely, even hold sporting events. And I just couldn't get any buy-in or even barely any acknowledgement from the White House. And so there was just business as usual with everything opening up. And now we're going to suffer the consequences of that. So, it's never too late to fix things. The problem is right now there's no political appetite for it. And now we're just a few weeks ahead of the election. And, I was very frustrated because when I was putting out my October 1 plan, people would say as kind of a snarky response, well, I don't need your October 1 plan. I have my November 3rd plan, referring to regime change at the election. And I said, that's not a plan. Because there's no such thing as a November 3rd plan. There's a January 20th plan, which by the time people find where the washrooms are in the White House and how to work the microwave, is a February 20th plan. And by then we could have 400,000 dead Americans. We're already projecting 300,000 deaths by the end of the year. I think we'll get there, and we could easily be at 400,000. So this is just a heartbreaking tragedy. And I'm still rattling the cage and spending all of my time when I'm not involved in our science meetings, lab meetings, accelerating our vaccines to see how we can fix things. But as we move closer to the election, it's apparent that the strategy, just let it rip and deliver a disinformation campaign. That is the White House strategy.
In Texas, our numbers have improved, certainly from the summer surge. Going, through August and September, we've been on a decline, particularly when it comes to hospitalizations. But the rate of viral transmission in the community still remains, I believe, higher today than it was in the spring. At what point, before the surge, obviously, at what point or how little community spread do you need until it is safe to reopen schools? Sort of, where is that threshold?
Well, it doesn't matter. The decision's already been made. Schools have reopened in many parts of Texas and Houston. I'm holding my breath to see how it goes. But, even though things are better than they were a month ago in July and August, they're still pretty high. At our peak in July, we had around 10,000 new cases a day in Texas, which you really have to multiply by a factor of 5 to 10, 50 to 100,000 new cases a day. That's the real number. And now we're down to around 3,500, 4,000 new cases a day, so less than half of what it was. But remember, that's still a log higher or more than where we were back in May. So we're still starting at a pretty high level, and now it's going back up. So I'm afraid we're not going to be in for a very good fall. It's going to be a tough autumn. And I just hope people can adhere to wearing masks and trying to stay safe, minimize your time outdoors and restaurants, and certainly not bars. But right now, there's just not that national leadership to hold off on a resurgence. And I think it's going to be particularly bad. So far, it's looking like in the middle part of the country. So we're seeing numbers starting to go up significantly in Arkansas, Oklahoma, and Texas, Missouri. And then we're seeing it up in the Dakotas and Iowa. So if you could carve out a whole box in the middle part of the country, and that looks like what that's where we're probably gonna start seeing that fall resurgence at least begin.
We've got about a minute left here, and I've got one audience question for you to switch gears a little bit. Vaccine clinical trials or any kind of clinical trials have sort of historically had difficulties getting a diverse array of participants, particularly getting participants from marginalized backgrounds. Is there any indication that on the coronavirus vaccine we're doing better on that front?
Well, I do think you're starting to see some of the pharma CEOs make that commitment to include underrepresented minorities in clinical trials. So the Pfizer CEO announced that he was going to go from a 30,000 person study to a 44,000 person study to accommodate that. And the reason that's important is, as I've highlighted, African American, Hispanic, and Native American populations are disproportionately being affected and dying from this virus, especially at young ages. Problem number one. And then problem number two, they remember those groups represent a third of the US population. So right now, I think the last number I saw was only about 18-19% were being represented in clinical trials. So that's really important to fix, and because this is going to be an important population to vaccinate.
Well, Dr. Hotez, we're all out of time, but thank you so much for joining us. Always a pleasure.
Always great talking to you, Edgar. I appreciate it.